Hey, good evening, everybody from the COVID-19 therapy support group and from Facebook. Just wanted to touch base with everybody tonight and do a video on trauma-informed care. So, anytime you're dealing with patients or clients that have a history of trauma, I think it's important to understand the areas of the brain that trauma affects and what those areas of the brain are responsible for. So, when dealing with trauma, the areas of the brain that are involved are the hippocampus, the brainstem, the amygdala, and the prefrontal cortex. So, what are these areas of the brain responsible for? So, the hippocampus is the learning and memory center of the brain. The amygdala is the emotional regulation area of the brain. The brainstem is responsible for the fight or flight response, or collapse or freeze. And the prefrontal cortex is involved with executive functions, executive cognitive functions of the brain. So all your higher level decision making, etc. So when a traumatic situation happens, or when you're dealing with a patient or a client who has a history of repeated past traumas, what's going to happen is two hormones are going to be secreted inside the body. One is adrenaline, and the second is cortisol. So let's start with adrenaline. So, traumatic event happens, adrenaline is triggered, starts being secreted throughout the body. Um, the first part of the brain that the adrenaline affects is the hippocampus. Now, how does it affect the hippocampus? Well, the adrenaline actually kills cells in the hippocampus. Um, so it's toxic to hippocampal cells. And basically, what happens is the cells in the hippocampus die when there's a traumatic event. And if there's repeated past traumatic events, the hippocampus in an MRI or some type of electronic imaging will actually appear and look smaller in somebody who's had a history of repeated past traumas. Their hippocampus will actually shrink because the cells will die off each time the adrenaline is triggered, and it'll actually shorten the size of it. And which affects what? That affects learning and memory. So the more cells in the hippocampus that died, the smaller the hippocampus is, the more impaired the learning and memory is going to be. So it's very common for somebody with past trauma to have short-term memory loss, and it's also very common for them to have delayed processing, right? So it takes them longer to process information than it would take somebody who has a normal-sized hippocampus or who hasn't been through as many traumatic events. Um, the next area of the brain that's affected is the amygdala, but the amygdala is not affected by the adrenaline. The amygdala is actually activated by cortisol. So the adrenaline hurts the hippocampus, but the cortisol actually triggers the amygdala, right? So in the hippocampal region, the adrenaline creates a situation of underactive hippocampal functionality, and when it comes to cortisol, it actually creates an overactive amygdala. And how does that happen? So the cortisol triggers the amygdala to start going into overdrive. Usually, when you're involved in a traumatic event, one of the most primary emotions that you have is fear, right? Sometimes you'll attack somebody out of fear, right? So if you feel threatened by someone and you're in a fearful situation, one of the things that might happen is you might attack them, right? Spur of the moment, impulsive. But when you're attacking them, you're really attacking them out of fear. You feel threatened. So you're reacting to that fear. And that kind of goes into the fight or flight response that we're going to talk about a little bit later on. So somebody who has repeated traumatic events happen to them, what happens is the amygdala is constantly in overactive mode, right? And fear response keeps getting triggered over and over and over again. And eventually what will happen is the amygdala will become super overactive in people who've had a lot of past traumatic events, and they'll have a very, very difficult time regulating their emotions because what will happen is the cortisol will cause the amygdala to be so overactive that eventually it starts functioning improperly. And what I mean by that is, since the amygdala is the emotional regulation of the brain, right? Um, people's emotions will stop being regulated in an appropriate manner. So, like if something happens that makes you really angry, it's going to take you a really long time to diffuse that anger biochemically because of all the past traumatic events that you've had, right? Now you have delayed regulation in your emotional processing. And that comes from an overactive amygdala. So it's very common in patients with history of trauma to have a very difficult time managing emotions, a very difficult time in relationships. Sometimes they're overreactive in relationships. Sometimes they're underactive in relationships. Sometimes they isolate or they disassociate while they're in relationships to kind of gather themselves. This is all common, and it's a response that you'll see in people with repeated past traumas. Another area of the brain that's affected is the brainstem. The brainstem is responsible for the fight or flight response, like we talked about earlier. And the fight or flight response is basically when you feel threatened or fearful in a situation, your amygdala is activated, and then you make a split-second decision as a result of that feeling of being threatened or that feeling of being backed into a corner, right? So you have a couple options. You can fight your way out of the situation. You can run away from the situation or flight. You could freeze, which means like you just don't know what to do. You haven't gotten to a point where you can make a decision, so you've just frozen in time. Or you can just collapse. And that does happen sometimes with people who are in repeated past traumatic events. They'll faint, or they'll just collapse and give up, or they'll go into the fetal position. And that's kind of like their way of saying, I surrender, I give up, just make it stop. Um, so the brainstem is, responsible for those decisions that you have to make in a fight or flight scenario. And that can also get jumbled. What could happen is you won't be in a fight or flight situation, but you'll interpret it as a fight or flight situation as a result of being in many past traumatic situations. You'll start to jump to conclusions that something's fight or flight when it's not. So that area of the brainstem will start to get triggered more frequently in times where it's not really appropriate for it to get triggered. And that just, that has to do with the amygdala and the brainstem working together. The last part of the brain that's affected by trauma is the prefrontal cortex. And like we talked about before, that's the area of the brain that's responsible for all your higher level cognitive functions, your decision making, your ability to process complex information is all done in the prefrontal cortex. And oftentimes what will happen is the prefrontal cortex will become underactive as a result of past traumatic issues. And the way that'll happen is when you're constantly being faced all the time with traumatic scenarios over and over and over again, like, for example, somebody in a domestic violence situation, the prefrontal cortex will now become overactive because you'll have to start dealing with really complex situations that don't have one solution. A lot of them have many solutions. So, if you're in a domestic violence situation, but then that person is responsible for your financial well being, of course, safety comes first, but how safe are you going to be in a homeless shelter with other people who are criminals or possibly, So you have to kind of like weigh the pros and cons. And usually, somebody who's in constant traumatic situations all the time or is faced with those types of situations all the time, they'll constantly be having to make these really complex, difficult situations over and over and over again. And it zaps their prefrontal cortex. Also, your perception tends to be off when you have had past, repeated past traumatic things happen to you. So, you might be overthinking things a lot, um, constantly trying to go above and beyond is a very common thing that you'll see from people who have had past trauma. They will overthink things to the point where they actually like exhaust like other people who haven't had past traumas because they're just so nervous about making the wrong decision because they've been put in so many different scenarios where if they didn't make the right decision, bad things would happen. So then all of a sudden, every single situation becomes an important decision. So indecisiveness is a very common trait that will come from people who have had, again, repeated past traumatic situations or, a lot of trauma happened to them, especially like over a small period of time. You'll see that. And that's my video on trauma informed care. And one of the things that we try to do um, with individuals who have had, multiple past traumas happen to them is create an environment of safety. Create an environment where they can share whatever they want to share. There's no judgment. There's no, you know, the person who's counseling somebody who's, you know, a trauma victim, they're usually very laissez-faire. They're usually very like laid back. And, if you want to be effective with this trauma-informed care type of therapy, you have to be somebody who doesn't get rattled easily. You have to be somebody that can listen really well, empathically, and allow the client to express themselves and only give little pieces of input at a time. You don't want to overwhelm someone or re-trigger someone that has been through multiple traumatic situations. The therapist has to be very careful how they interject and when they interject, right? So how you say things and when you say things are super important when you're doing therapy with trauma clients. So, just something to keep in mind. It's a very sensitive process. So you want to create like an environment of healing. Um, Somebody who's had past trauma, when they finally do give in and they decide to participate in therapy, it's a huge decision for them. It usually takes like a lot of courage because you're going to have to talk about things that you really don't want to talk about that are really upsetting to you. And you're doing it because you want to get better and you want to function better and you want to be more successful in your life. And, most of the time, people who come to therapy because of trauma, they feel like they're being held back in terms of meeting their full potential. So they're coming to the therapist to say, hey, can you guide me along a path where I can be more functional and more successful in my life? And a lot of times that starts with very, very, very small steps. You don't want to overwhelm somebody who's already been through so many traumatic situations. You're just going to trigger them again, and then they're going to regress, and then they're going to say therapy sucks, and they're going to go and they're going to kind of do their own thing for a while, and then if they're lucky, hopefully down the line, they'll try to do therapy again with somebody else, right? But sometimes that doesn't happen. If they have a bad experience, they might just be like, you know what, I'm done. That's it. I'm finished. Sometimes that can mean they're not ready for therapy, and sometimes that can mean the therapist just wasn't skilled enough to help them navigate through their issues. So, very important to kind of take it slow, small steps, only interject like when it's really super appropriate, and give the person a lot of time to express themselves, give them a lot of time to explain things fully. Um, you know, just kind of be an outlet for them at first. Let them get comfortable with the whole entire therapy paradigm. Because, of course, like as the therapist, they're going to be they're going to be feeling you out. Like they're going to want to see, like, is this someone I can be safe around? Is this someone who I can express things to and they're not going to hurt me or try to use it against me? Because, if you're, a male or a female that's been through multiple traumatic situations, you've probably been taken advantage of. You've had people harm you in multiple different ways. So, you're always going to be on guard and you're always going to be on lookout for that next person that's going to try and do that to you. So, again, it's very important for the therapist to be super laid back and just kind of let the chips fall where they may, and only interject small amounts of information at a time, and just let the person kind of go through the healing process on their own and face the amount of trauma that they want to face at their own rate. Don't try to dictate the rate of how much they deal with at once. You have to give them that control. They'll deal with things when they're ready. And that's all I got for today. So, if you want to like the video. And, if you feel like anything that I said was helpful, let me know what was helpful. All right. Take care. Have a great night, guys. Bye.